I will take us through the vascular morphology on Doppler between benign and malignant lesions. The learning objective, therefore, is to differentiate the vascular pattern on Doppler between benign and malignant lesions. The cases used in this lecture were managed in 2 hospitals in Borno State. The morphology of vessels can actually give clues on whether one is dealing with a benign or malignant lesions. When 2D Doppler is used, the vessel is only seen in a single plane, but the entire vascular tree can be assessed using 3D. While 2D assesses the path of linear vessels, in addition, 3D also assesses the path of non-linear vessels. The vascular morphology is actually a subjective assessment. Yes, 3D gives very good assessment of the vascular tree, but when glass body display is used, the views are excellent. This is further enhanced when Cineloop is used, which gives a global view of the vascular tree. Generally, the vascular morphology is best studied for bulky solid lesions. This slide shows the difference in vascular morphology on Doppler between benign and malignant lesions. While the vascular arrangement in malignant lesions is described as chaotic, they are orderly in benign lesions. In benign lesions, the vessels are straight or slightly curved, while in malignant lesions, they are tortuous and coiled. In benign lesions, the caliber of the vessels are normal, while there are variations in caliber in malignant lesions. The vessel density is low in benign lesions, while it is high in malignant lesions. In addition, in malignant lesions, the vessels are multiple and show frequent branching. Microaneurysm and stenosis are also seen in malignant lesions, and looping and bridging are also common features in malignant lesions. Understanding of the Doppler morphology between benign and malignant lesions is depicted in this slide. This is a military parade, and we all know that the military is a disciplined institution. Now, if you look at this arrangement, either way, this way or this way, everything is disciplined, everything is orderly. This is what is seen in benign lesions. The vessels are disciplined, the vessels are orderly. One can trace the beginning up to the end of a vessel, and the caliber is most times normal all through. So, the architecture of vascular appearance in benign lesions is like that of a military parade. Everything is orderly, everything is disciplined, and one can trace from one end to the other. On the other hand, I see the appearance on Doppler in cases of malignant lesions as a riotous situation. In such a situation, no one is in charge. The environment, as seen here, is chaotic. You can see the variations in the type of individuals who participate, from the old to the young, including the crippled, participating in a riotous situation. So these are the kind of variations you see in vascular morphology in cases of malignancy. Again, look at the density here. It's a flow density. Here, in a riotous situation, the density is high. Again, you can see individuals carrying different sorts of weapons, from cutlass to broom to stick. So this looks like the multiple and frequent branching seen in malignant lesions. So everything about malignancy is disorderly, is not disciplined, and since no one is in charge, there is no control. Malignancy does not respect borders, and malignancy does not respect its neighbors. Now let's look at normal 2D Doppler features. This is color Doppler of corpus luteum, the ring of fire. Look at the orderly display of the vasculature to this corpus luteum. The same case here. This is another corpus luteum. Look at the typical ring of fire appearance, and not the power Doppler flow to this dominant follicle. Note the discipline arrangement of the uterine vasculature. This is the aquatic vessel that has taken up color. Here you can see the aquatic vessel has taken up color. So you can trace the aquate radial spiral. Here you can see the spiral supplying the zone 2 of the endometrium, and one can trace it back to the aquate arteries. So this is a disciplined arrangement of vessels, which is in keeping with normal findings. Again, although this is tortuous, but the vascular architecture is orderly. Again, look at the blood flow to the various stroma, orderly blood flow. Now looking at 3D Doppler of benign lesions. This was a 32-year-old multipara who had a spontaneous miscarriage at 20 weeks of gestation. Not the vascular morphology on the rendered image, the orderly arrangements of the uterine vasculature, and the pattern as seen on this CD loop. This was a patient who had infected uterine fibroid, and so you can see the engorged but normal vascular pattern. You see that? Normal arrangement of the vessels. This was a case of a molar pregnancy. Again, look at the discipline arrangement of the vessels. And on this flow HG again, look at the discipline arrangements of the vessels. This was a 57-year-old multipara who presented with pelvic organ prolapse. Note the vascular flow to the posterior lip of the cervix, and look at the still image. This vascular pattern in this patient is suspicious. Now let's look at the cine loop. You see that this vascular arrangement fits the description of malignant morphology, and therefore a biopsy is necessary. This patient had a cervical polyp. Look at the polyp at the side, and look at the distilling arrangements and the low density vessel to this polyp. And look at the flow HD for the same case. This was a uterine contraction in the first trimester of pregnancy. And these are the dilated aqueous vessels as a result of pregnancy. So you can see the dilated aqueous vessels and the cine loop of the same case. This was a patient who presented with abnormal vaginal bleeding, and you can see the rendered image brought within the endometrial cavity with a thicker luteal cyst, the cause of which we couldn't determine. Not the vascular flow to the uterus. This was a case of adenomyosis. Look at the rendered image. Look at the discipline arrangements of the vessels and on cine loop. This was again another case of adenomyosis. Look at the low density flow, the orderly arrangement, and the appearance on cine loop. This was a patient who had a vascularized dermoid. So look at the arrangement of the vasculature on the still image and on the cine loop. Now let's look at 2D Doppler of malignant conditions. This was a case of advanced cervical cancer. Look at the dilatation, the looping, stenosis, the chaotic distribution, and look at the kidney on the same side where you have this ureteric dilatation. These are the case of advanced cervix. Not the hue, the color topic, take up here. Everything here is bizarre. This was the case of advanced CA cervix on 2D. Again here, not the dilatation here, change in caliber, aneurysm here, stenosis, branching, all features of malignancy. This was a nodular omental deposit in a case of serous adenocarcinoma of the ovary. Look at the pattern of the vasculature in keeping with malignancy. This young girl had a yolk sac tumor. So look at the branching, the dilatation, and the hotspots, all in keeping with malignant lesion. This was a case of an endometrial carcinoma. Look at the beaded appearance here. Microaneurysm, stenosis, microaneurysm, stenosis, branching, looping, all features of malignancy. Now, let's look at the 3D Doppler of malignant conditions. This is the HD flow, and this is the flow HD of the same case. This is the rendered image of the same patient who was managed as a case of advanced cervical cancer, but ultrasound can suggest more of a metastasis to the cervix from the ovary. Now in this image, we can see virtually all the features of malignant vasculature described in the literature. Here is looping, another looping, another looping, and many more loopings here. Here you can see stenosis, dilatation, 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 Here, look at branching. And here, you can see all these features. You can see a looping here, stenosis here, dilatation, branching. So this is the single loop for the same case. Display this chaotic or riotous vascular appearance of malignant lesions. This was a case of advanced cancer of the cervix. You can see on this still image. Look at this density of vessels. Look at all these features described of malignancy. And look at the single loop. Clearly in a 360 degree, showing all features of a vascular or malignant lesion. This was a patient with endometrial cancer. Look at the density of vessels here, the chaotic appearance, and the single loop. Look at the riotous arrangements of these vessels. The dilatation, the looping, stenosis, bridging, branching, and all these features are seen on this single loop. Here was a case of suspected ovarian cancer, not these features of malignant vasculature on this HD floor. This patient was diagnosed with adenocarcinoma. Look at the blood vessels. Dilatation, stenosis, branching, looping, all the features of malignancy. Look at these features, well illustrated on this single loop. These 50 are all presented with abdominal mass. It was discovered to be a solid ovarian lesion with this lead vessel as described by Antonia Testa. And look at the single loop of the lead vessel and the single loop of the blood flow to the other aspects of the lesion. Look at the features of malignancy clearly displayed here. Branching, looping, aneurysm, stenosis, bridging, everything. Unfortunately, this patient couldn't afford surgery and left against medical advice. This was a case of cervical cancer. Again, look at the arrangements. The high density flow here, dilatation, the looping, stenosis, branching. Look at the single loop of this case of cervical cancer. This was a case of high-grade serous papillary carcinoma in a young girl of 20. Look at the vascular pattern to the papillary projection. So our take-home message is that vascular morphology on Doppler can help differentiate between benign and malignant lesions. However, all other parameters have to be taken into consideration before such a diagnosis is made. Thank you for listening.